Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humor and a lot of heart. So pull up a chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins. I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a Menopause Society certified practitioner. I have a private telemedicine practice, and I see patients in several different states.
I am Dr. Aoife O'Sullivan, a board-certified family physician and Menopause Society certified practitioner, and I see patients through my telemedicine practice here in Oregon and Washington.
I'm Dr. Hart Kress, a board-certified women's health nurse practitioner and menopause certified practitioner, and I see patients via telemedicine in several states as well.
Today's guest is someone we're very excited about, not just because she creates beautiful skincare, but because she's been quietly and consistently showing up for women in this space. Kari Gran is the founder of Kari Gran Skincare, a brand built on simplicity, transparency, and actually respecting women's bodies, especially during hormonal transitions.
She's been a huge supporter of the menopause movement and has generously backed menopause-related events for women with her products, which tells you everything you need to know about who she is.
Today, we're diving into skincare during perimenopause and menopause, what actually works, what's complete nonsense, and how to take care of your skin without needing a 12-step routine or a second mortgage. Kari, welcome. We're so happy you're here. Thanks so much for joining us.
You're welcome. Nice to be here. Hi, ladies.
Hi, Kari.
Hi.
This is so great.
You're calling into us from Seattle.
I am.
How's it looking up there today?
It's going to be almost 70 degrees here today, which for us Pacific Northwest mushrooms, you should all know that this is exceptional. The rain will return tomorrow. And in all transparency, I will say I am born and love the Pacific Northwest weather. So I like the rain and the gray.
Oh.
I know I'm an oddball, but I do love it.
I think there's a lot of people in the Pacific Northwest who feel like that. Mm-hmm. Like we moved here for that. You know, we needed some Irish weather.
Yes, I've been to Ireland and I loved it because it was gray.
Yeah. And everything around you is green. The sky is gray, but everything else is green.
Yes, I do love the green.
I know it does. It looks so lush in the background today.
Yeah.
Beautiful.
I do love the green.
Kari, tell us how you got into skincare. At what point did you realize the industry wasn't telling women the full story?
Oh, boy. Well, I mean, honestly, I think that the conventional industry has fed women such BS for so long that I bought my first jar of eye cream at the Lancome counter, anti-aging, when I was 19. It cost me like my entire paycheck. But, I was convinced at that age that I needed to fix something because something was wrong. So I think that that's just been embedded into how we're socialized as women, not that we're fine as we are, but there's something wrong. And if I could go back in time, like with all that collagen and elastin and resiliency in my skin, and just say, step away from the tanning booth, get out of the sun without sunscreen, and you will be doing yourselves so much. I mean, what you will pay forward is so huge. So, and then honestly, starting a skincare company when you're 43 is no easy feat on your psyche.
Yeah.
I would say the hardest part was what it did to my brain because, I loved the category. I had always loved the category. I thought it was fun. I was always interested to try something. But when I came to it as a business, what happened was looking at it through a business lens and a woman who was 43. I'm now 57. And so, it was a while ago. I was like, wait a minute, I don't see anybody that I can relate to anymore. And so it's either really, really, really young women, or it's that Centrum Silver Fox, the over 75 gray haired, beautiful woman. But I was like, wait, I'm 43. What, talk about feeling invisible. And then I felt like beaten down by it. I felt completely beaten down by it. So that was a real, that was a really hard thing to deal with, in all honesty, because it didn't make any sense. And the other thing that wasn't happening was there was no conversation around perimenopause or menopause. And I was diagnosed with autoimmune thyroid disease when I was 27 and had radioactive iodine at 29. So, sitting in the nuclear medicine office, looking at the pamphlets of all the people in their 80s going, that doesn't make sense. That's that doesn't look like me either. So having chronic dry skin, having ongoing autoimmune issues, and then because I hit perimenopause so early because of the autoimmune issues, I was easily there at 35. And so everybody thought it was my thyroid that was creating all of the upset. So the dry skin that I had got drier. I was lucky as a teen. I never had acne. I mean, I was so lucky. I was so blessed. But I did when I was 43. So it's like, wow, this is new. This is not fun. And it wasn't until I was 50 that I even started hearing anything about perimenopause or menopause. And by that time I was already postmenopausal.
Oh.
So I feel like I lost 20 years of, just feeling like I was in the zone of chaos is not an understatement for some, not for everybody, but it does do considerable damage to your skin. And I think that's one piece of the puzzle that we're not yet really talking about as much as we could.
Feeling off in midlife? I'm Dr. Rebbecca Hertel, and I offer concierge telemedicine across multiple states focused on hormones, weight, libido, and sleep, and longevity. Let's get you thriving. So visit www.osteopathicmidlifehealth.com.
Because that 30% of collagen and elastin that we lose across that menopause transition, that is much easier to keep than it is to get back.
Yes. Correct. Yes, that is well put. That is exactly what happens, because, you often hear, wait, I woke up and what happened? Like, it doesn't happen overnight, but it feels like it happens overnight. And I also think that we are fooling ourselves if we think there's one thing that fixes it. There's no topical. It's like a wagon wheel. It's lifestyle. Mm-hmm. It's, what you eat, how you sleep, do you mitigate stress, all the things. And so I'm just so grateful that we're having this conversation now. I'm the elder stateswoman in my neighborhood, so I'm bringing all the 30 and 40-year-olds along and sharing everything that I know. So that's all. There's no magic bullet, but there are a lot of little levers that you can pull along the way that will make things so much better.
So they're lucky to have you.
So it seems like you were new into the industry. If I'm
completely.
Yeah. So what was important to you when you were designing what would be your catalog of products? Because, nowadays it's like, okay, what should you use? Do you need to wash your face every day? Do you moisturize? Do you add tretinoin? Do you do estriol? Like, what was kind of like your thoughts when you were designing what would then become your brand line?
So I left a career that I had had for about 20 years, give or take, and I took a year off. And it happened to be when I was really, really, really struggling with my health. And one of the things that had cropped up during that time was my dry skin had become so much drier. So for me, during that time, I did a ton of yoga. And through yoga, I found the practice of Ayurveda. And through the practice of Ayurveda, I learned about oil. So that's the road that led me to oil on the skin. And because I'm a product of the 80s, you know, really cutting my teeth in the beauty industry, you did not put oil on your skin because it would make you break out, right? So yes, not all oils are created equal. So for me, it was discovering, oh, wow, women in other parts of the world have done this for centuries. This is not, I didn't make this up. This isn't new. So I discovered that after so many attempts of putting a cream or lotion on my skin, having it feel great for about 5 minutes, and then this incredibly fast dry down, and then I was dry again. What happens with the cream or a lotion is that it's always typically formulated to be at least 70 to 90% water. There's nothing wrong with water. Water's great for us. We drink water. Our body is made of a lot of water. But in our skincare, it doesn't have the lasting ability that an oil or an emollient has. And so I discovered kind of like off the beaten path, health food store, bottom shelf, not so great smelling, but it felt good on my skin. And I would wake up in the morning and I would still have that feeling of being hydrated. So that was my first clue. And from there, I just dove like so deep. Aoife, you probably are familiar with Bastyr. The college that, Bastyr is a local college in Seattle that trains a lot of naturopathic physicians. They also have an entire arm of different courses, and one was on essential oils and the clinical uses of it. And so I did that. I read the esthetician's textbook. I started playing with things in my kitchen. And I took a year and developed something that I really liked for myself. And then I shared it with my now business partner, who is a good friend, Lisa. And she's our CEO, and she's 10 years older than I am. And so I was early 40s, she was early 50s. And I gave it to her as a Christmas gift. And she thought, okay, you've drugged me to Sephora. You've drugged me to all these places. You've made me try all this stuff. I feel like nothing works. I think you're crazy. You make me do it on one half of my face and something on the other half of my face. And like, I don't know what to do. And she said, but this, like my husband went, wow, your skin looks nice. And she's like, he never says a thing. Like never, like he notices nothing like that. But I think we're so focused on fixing, repairing, doing all of these things that we forget about the basics. So the health and the hydration of the skin's barrier in particular is paramount to everything else working really well. So that's my very like all over the place way that I started, was just like I took a deep dive. I did it for myself. I shared it with a friend. She's like, you don't have a job, because I left my career and just took a year off. Yeah. And it was like the post 2008 recession. It's like, what am I going to do? I'll go work at the drugstore down the street. I don't know what I'm going to do. I just was so burned out. And what I didn't know, perimenopause was like in full effect. Dry skin was in full effect. And so all of these things led me to oil, which the short answer to your question is I love an oil forward routine. It's concentrated. It's nourishing. It makes actives that you add to it really biocompatible with the skin. It's just like for somebody who was switching products from the time they were 13 to the time they were 43, 30 years, who's now used the same exact thing for that period of time. It's like, Lisa called me a heat-seeking missile, because she'd be like, if there's something that comes up, you're just like, we're doing this now. We're going to try this. It's exhausting.
It is.
And it's exhausting. And so I really just wanted something that looked good, it felt good, and it was good for me. Those were kind of my benchmarks, because at that point in time, the clean or natural space wasn't like mainstream. So all of the products looked like they were a little sad. You know, for somebody who really loved the category, they were just like, oh, you know, for me, it's an experience. I want it to be something that I want to do and that I want to look forward to. I don't want it to be like flossing my teeth, which I know is good for me, but I just don't like to do it.
You don't want it to come out of a Trader Joe's bottle.
You don't.
No.
And the other thing is I didn't want it to come out of a plastic bottle.
Yeah. Yeah.
I know it's funny because Aoife and I were talking about that last night, how we grew up not putting oil on your face.
No.
And how we both
that was a no-no for that very same reason.
Yeah.
all the oil, please, all of it.
Yes.
Want the Dusty Muffins at your next event? We do panels, live podcasts, and talks that bring the heat, literally. Corporate, see-me, or retreats, we've got you. So hit us up at thedustymuffins333@gmail.com or DM us on Instagram at thedustymuffins.
And now when you use a very small amount of it, because it's concentrated, it doesn't have any fillers. What it does is, I think that we're so chronically dehydrated, both inside and outside, that you get a little bit of that on and you're like, wow. So really the focus for us is health and hydration and not youth and perfection, because that's a losing game.
Yeah.
I'm trying to teach my girls, that every single thing they put on their skin, and our skin just absorbs everything. It just soaks it up, has chemicals in it, Yeah. So you get up in the morning, you jump in the shower and you apply your shower gel or whatnot. And then you might put on your, wash your face with something else, put on your lotion, some sprays of perfume, and then, some makeup. And each of those things, our skin is just lapping up everything that's in there. And it all adds, layer on top of layer on top of layer. And so to remove some of those and to go with something natural is just really lovely. Makes me feel better.
There's just a really, a less is more. And if you can get a product that actually can multitask as well, I think that that's a real benefit, because, I had the 12-step routine, literally. That's not a joke. And even for people who think they're minimalists, if you track each thing that you use from the minute you get up till you leave the house, it's like 15 to 20 products.
Right. Scary.
So it's a lot. But I will tell you that I think our line has evolved and changed a little bit, because it was really just, really the focus was botanicals, plant and essential oils and hydrosols. And then as I got older, the line had to evolve a little bit with me. And so then that's when we went into the world of sunscreen, peptides, vitamin C, and now we have a true moisturizer, because like you said, not only does the collagen and elastin diminish, estrogen regulates the moisture in the cells of our body. And so if you never had dry skin, you may get to experience that.
Yes.
You get a little bit older.
You sure will.
And so it's like I said, it's a pulling of the levers all the time, but it doesn't have to be complicated. It can be relatively simple.
I'm fascinated how the cleanser works. So tell our listeners, because you're saying it's an oil cleanser.
It is.
And right. So it seems counterintuitive, where you're like, wait a second, how's that going to get my makeup off? How's that going to wash my face? Can you go through that with us? I
can. So I don't know if any of your grandmothers used cold cream.
Yes.
Yes.
Ponds. Mm-hmm.
Yes.
Mm-hmm.
Avon.
That's all there was in Ireland.
Yep.
Yep.
Ponds,
Everything is Avon.
And so my grandmother used cold cream, and I would just watch her put it on, leave it on for a long time, take a washcloth and remove it. And so that didn't make any sense in my teenage mind at the time. But the chemical principle of oil, it's a like attracts like system. So with a true cleansing oil like we have, that doesn't have a surfactant or a foaming agent, or it does not become aqueous, meaning that when water hits it, it breaks down. Some cleansing oils do that, and I think it's really targeted to the American audience because we're like, I don't want oil, I'm afraid of oil. So it cleans the skin without stripping the skin of its natural oils. So you can also do a really great massage with it because you get a lot of slip. It has organic castor oil, which is so viscous and heavy, it doesn't break down. You don't want something that rubs in and then you're tugging and pulling on the skin. And the beauty of a massage for the skin is that it stimulates circulation. And circulation is really good to help with collagen and elastin. So again, it's this multitasking approach to it. And then the one thing you have to remove it with a washcloth. It will not splash off with water. You could splash it all day long. It will not come off. And you have to use a fresh, clean washcloth every single time. So until I had the cleansing oil, I was like, washcloths are for suckers. Who needs a washcloth? Why do people use a washcloth? I don't understand this washcloth business, because I was using a foaming cleanser, which left my skin feeling really squeaky and tight, which is not a good sign. Because what that does is if you have oily skin, your skin goes, oh, all the oil's gone, I should make more. And if you have dry skin, you're like, wow, all the oil's gone and I feel even drier than I did before I started.
And they even teach you to use it twice. Once isn't enough. Do it twice.
To wash.
Yeah, the double cleanse. So for me, I was really into, like, I cleanse at night. I do a long massage. I've said this before publicly. I watch Jeopardy and I massage my face. That's my routine. That's my Pavlovian response to it's time to get ready for bed.
Yep.
So you don't have to massage it for that long, but you could just leave it on as a mask. So castor is a purgative, so it draws. You know, like a poultice, a castor poultice draws out things from the skin. So it's just a really nice way to clean the skin. It will feel soft, but it won't feel dry and tight.
Okay. I mean, I love it. So
thank you.
I love all the products.
So even my kids use it.
We'll come clean here. We are all
And did you know off-label you can use it as a shaving oil?
Oh, that's even better. I like multitasking products, right? Because when we travel, which they also come in little travel size, which let me tell you are the best little things ever. I love them because
I do too.
It's so great. They're small, they're little, they go with you. You can use them for multiple things. It just, they feel good. People tell me about my skin all the time. They're like, what are you using? Yeah. And so, every now and again, then I'll be reminded to throw that on Instagram. I'm probably about due for that again. But
for anyone listening, this is not a sponsored episode.
No, it is not.
We have Kari on because we all use her products.
And we love it.
We all love them. Just like when we had Scene Nutrition on, we all use their products. We all love them.
I love Scene Nutrition.
So do we, Kari.
I love their product.
We just want to share the products that we use and love every day, and with all the people who listen to us.
And we love women founders. And so we try to, also make sure that we can get that out to women to help support too. So everything will be at the show notes too. So that way you all can try out Kari's things. What do you think, Kari, is something that's wildly overhyped that you wish would just go away in like the skincare world?
The whole like concept of slugging, when you like coat the face in like a Vaseline or an
Oh,
Aquaphor.
yes.
Yeah.
Yes.
I think that that's, those products serve a purpose. Aquaphor in particular, if you have like an open sore or something that needs an occlusive, that is like a saran wrap on the skin.
Yes. And you said it, occlusive. So the difference, let's do the difference between Vaseline and Aquaphor being an occlusive things. And we've all done that in like our derm or our wound care with patients versus your product and the oil that's in that. Can you kind of teach our audience about the difference?
So for the one product I think that's going to be the easiest to think about is our lip whip. We have a lip product, and it's a really creamy, thick texture, similar soft that you would, dip your finger into a Vaseline jar or Aquaphor jar. But the difference is it doesn't contain petroleum. And so mineral oils and petroleums are occlusives. And occlusive just simply means it's got a great big fat molecule that sits on the skin and does not penetrate. So its goal is to coat it and cover it like you would just wrap it in saran wrap. So the upside of that with wound care is it gives your wound a kickstart to healing. The downside is it doesn't let your barrier breathe. So our skin is our body's largest organ. It's meant to absorb and excrete. So it's got this, this flow. Now, if you put saran wrap on your hand, you could dunk it in water and nothing's going to go in, right? And you're going to excrete, but it's stuck. It's not going to go anywhere. So with like the lip whip, for instance, it's got plant oils, botanical oils, and then it has organic beeswax. And while it's beeswax is a wax, it is a breathable barrier. So, we all probably got addicted to Carmex at one point in time.
Yeah.
In our youth. Or chapstick.
That brought back some memories.
Yeah.
Chapstick. And
you have to keep putting it on.
You have to keep putting it on because it just doesn't let that barrier perform the way that it's supposed to perform. So that's and I learned that lesson, honestly, very early on, because when I was, like I mentioned, I had really dry skin, and the skin on my body is like, all the women in my family have it, and we call it alligator skin because it's so bumpy and dry. And so I was using baby oil gel after every shower, ruining every towel I had. And finally, a dermatologist said, "You cannot do that. That's a bad idea." But I just thought, it's making my skin feel really good. I just didn't understand. Yeah. And until I really got into the skincare game, I didn't understand, as you mentioned, Aoife, that, our body is absorbing all this stuff because we don't think of our skin as an organ typically. Yeah. And then if you say, have you ever heard of a nicotine patch?
Have you been told your labs are normal, but yet you still feel exhausted, foggy, and gain weight simply by looking at a meal? Well, you're in good company. In midlife, normal isn't enough. You deserve to feel like yourself again. I'm Dr. Christine Hart Kress, a board-certified women's health nurse practitioner and certified menopause specialist. I deep dive into the areas often overlooked: hormone optimization, thyroid health, gut health, medical weight loss, including administering testosterone therapy for women. No rushing, no insurance hoops, just a blueprint back to a vibrant life. I'm accepting new patients in Virginia, Florida, and 5 other states. Book your clarity call at www.christinehartkressdmp.com.
Or an estrogen patch. Now, thankfully, we're talking about an estrogen patch.
There's so many medications.
You're getting a delivery system through the skin itself. So that's where I think that I don't want to demonize any one thing. I think that's unhealthy. But what I do want to do is provide the education of when might be the appropriate time. I recently had a significant allergic reaction to something. I was trying a whole bunch of products out for a future project and did something very bad to my lips. And let's just say I just kept not treating it like I should. And I ended up going the Aquaphor route for a few weeks because I couldn't get, I had just disrupted my barrier so heavily.
Yeah. We take it for granted for sure. There's no doubt about that with our skin. And it starts young, which is I'm after my kids constantly about sun protection and just treating your skin like gold because it'll make it so much easier as you're aging, you know?
Right.
It really does. So.
Right. So I think that, I mean, there's a million things, but the one thing that I will add to that is that since you mentioned sunscreen, it's one of my favorite topics. If you are not using sunscreen every day of the year, then you need to stop using anything else that has an active ingredient in it that you're using for a particular reason. Yeah. So we brush our teeth every day because we don't want cavities.
Yep.
We don't pick and choose the days that we're going to eat a piece of cake or a cookie because it has extra sugar in it. And then we're like, oh, I'm going to brush my teeth now. Same principle applies. Let's focus on being proactive and not reactive. Because if it's light enough to read a book, and I am sitting in Seattle, Washington, where we don't have sun every day of the year, but UVA rays are breaking down your skin's collagen and elastin. They are photosensitizing your skin if there's light. They penetrate clouds, they penetrate glass. There's this amazing photograph of this poor truck driver whose half of his face looks like it's completely falling off because it just was exposed to the light through the driver's side. He wasn't getting a sunburn every day. So just think UV aging, UVA. You want to protect your skin from UVA rays. The UVB rays are burning, but the UVA rays, they're going deep and they're breaking down our collagen and elastin every day. Even if you're indoors, like you can see I'm sitting by windows. That's enough to do damage.
Yeah, it is. I know. I do a sunscreen every day.
Every day. Mm-hmm. And then, you know, like hats, big glasses. It's just like, we know with tretinoin or retinol products that it makes your skin more sensitive to the sun.
Yep.
But I just see so many people chasing sunspots, fine lines, wrinkles, you know, all of it. And then they're not wearing sunscreen.
Right. Begin at the basics.
Right. It's just a foundational thing. And once you get into the habit of it, it's pretty easy, but it just is, I just cannot tell you how important it is. And the other thing is in the car, like treat the backs of your hands with sunscreen, like before you leave.
Yep.
Or wear a scarf if you don't want to, you know, try and wear sunscreen on your chest. Cause for me, it's like the Bermuda Triangle. There's so much sun damage here.
Yes.
I know.
Right.
That's probably where I see it the most on my, like from here to here is the chest for sure. Yeah.
So
I noticed it
I keep a scarf tied around my car thingy, you know, where you change the gears, whatever that thing's called. But just put it on in the car, or there's just little things that you can think about that will make a huge difference if you're like, oh, I forgot to put sunscreen, or I don't want to wear it. I don't know.
That's a great tip. That's a great tip for the summer, especially. The weather here in the Pacific Northwest, you know, it is raining 1 minute and the next thing it's 80 degrees. And so I love that tip, to just leave a little scarf, like a little silk scarf or something in the car.
Yeah, where I am too. You know, one day it's snowing and the next day it's 75.
Right.
Before we wrap up, Kari, any other words of wisdom for our listeners? The sun cream was a good tip.
Oh yeah, that was a great one.
Yeah.
They were all good.
I mean, really, truly, like find something that you can put on the backs of your hands, keep it in your car, just put it on the backs and then just rub this way so you don't get it all over the inside of your car like my car has it. And the other thing is lots of water. I mean, drinking water is such a great thing for our skin. If you do the little pinch test on the back of your hand, you'll know if dehydration has set in. It should
That's
spring
good.
back.
Yes, we got
It should
some
not
spring.
tent.
We got
It should not
spring.
tent. The other thing is excess sugar is really not great for the skin because it creates the process called glycation, which eats away your collagen and elastin. And I just don't think we have the same, like, I don't have the luxury of eating red vines and microwave popcorn for dinner anymore, like I did in my 20s, you know, or grabbing a Pop-Tart on the road because I was hungry. So I just don't have that same resilience. And then alcohol, which, you know, for me, if I want to sleep, and it doesn't do my skin any favors either.
Great words of wisdom. Kari, thank you so much for joining us here today. It's been such a refreshing conversation. Equal parts education and permission slip to stop overcomplicating everything.
Yeah.
We love what you're doing, not just in skincare, but in how you show up for women too. It matters more than you probably even realize.
Well,
for
I
anyone
think you guys do the same. So thank you.
Thanks,
for
Kari.
all the education.
Thank
I've learned
you
so much and shared your podcast so many times.
Thank you.
We really appreciate that. Thank you. And for anyone listening, we'll link Kari's products and resources in the show notes. You're going to want to check those out. And as always, if you love this episode, hit the subscribe button and share it with a friend. Every time you do, it helps us reach even more women who are looking for support and great menopause information. We'll see you next week, Muffins.